Hello, hello, hello. It looks like we're live. Yes, 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 yes. Oh, goodness. Oh, hello. Hello, hello, hello. It looks like we're live. Yes, 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 yes. Oh, goodness. Okay, I think that's it. Hello, everybody. Today we're going to talk about a new way to approach diabetes. So we are coming to you live so that we can talk about that. How do you guys like that? Oh, goodness. All right. Uh, My page here is not collaborating with me, but okay. All right. So today we want to talk to you about our diabetes type 2 solution membership. So I'm so excited to introduce to you this membership. It's a program designed to provide you with tools, support, and community. Everything that you need to actively manage your diabetes. This is our founding membership, and by joining now, you'll have a unique opportunity to help shape the program and lock in an exclusive price. My name is Alexandra Santamaria. I am the founder of RX Health and Wellness. You can visit us at rxhealthandwellness.com. To understand a little bit better the why behind this membership, I want to just give you a quick review of my story of how I am here. So by profession, I am a clinical ambulatory pharmacist. I manage chronic diseases such as type 2 diabetes. I am a certified diabetes educator, and I am also a functional medicine pharmacist. So being a health professional did not keep me away from having some of these problems. At age 40, I was diagnosed with pre-diabetes, high blood pressure, and high cholesterol. After I followed my doctor's recommendation and everything I knew, I lost some weight, about 20 pounds. And after a good few months, almost a year, I was able to get off my blood pressure medication, and much, much later after that, my cholesterol medication. However, in my late 40s, as I started to go through perimenopause and then follow up to menopause, my symptoms worsened. I experienced irregular periods, mood swings, and my blood sugar levels were all over the place. I gained a lot of weight back, more than what I had previously lost, and everything I ate didn't seem to agree with me. During the pandemic, my mother was very sick, so I was taking care of her, and I was also working full time. Looking after her and not getting enough sleep with the stress of the whole situation, not having a good diet, and going from having, a lot of appetite to no appetite and no sleep really left me feeling really sick. After my mother passed away, I was diagnosed with full-blown diabetes. I felt very sad and even went into a depression. I couldn't get my blood sugars under control. It was horrible. I felt like my fate was locked in and I was going to follow behind my mother and I was going to die early. I felt like there was nowhere else to go. Quickly, my medications were escalated to insulin, and so did my weight, even more after the insulin. Feeling desperate, I started looking into functional medicine, which I had previously learned about before the pandemic. Once I started applying what I was learning, everything got turned back. So why focus on type 2 diabetes? Well, because I went through it. And it's a condition that affects millions of people worldwide. It has a significant impact on our lives and our overall health. I've seen it firsthand, not just with my patients, but with my own family, my mother. The chronic nature of type 2 diabetes means that it will require a long-term strategy. However, there are real opportunities here to prevent and even put into remission type 2 diabetes. And that's by using functional medicine principles and lifestyle medicine. Why women over 40? Well, women in this age category face unique challenges. I told you I got worse as I started to go through perimenopause. So particularly due to hormonal changes in menopause, women not only have a higher risk for getting chronic diseases such as type 2 diabetes, but of course, they are an increased risk for cardiovascular disease. These factors increase your metabolic disorders and make managing a complex diagnosis such as type 2 diabetes even more complex. Age and life factors also play a significant role in the management of diabetes. So this is the group that I really want to help manage their diabetes. Combining the traditional medical care that I was so aware of with functional medicine principle became my new approach to try to get myself back. This included starting with the elimination diet. It's a very rigorous diet that identifies food sensitivities. Then I also incorporated anti-inflammatory foods into my diet to reduce systemic inflammation. I looked to improve my gut microbiome with probiotics, fiber-rich foods, and I started to address my mind-body connection to reduce my stress, and even more important, I addressed my mindset. I started to believe that I could get healthier. I started to believe that I could turn my health around, and so I did. I also took steps to remove toxins from my life. I'm still working on that one. I reduced my exposure to harmful chemicals in foods, in care products, in cleaning products. Like I said, I'm still working on that one. The first few weeks were very, very tough. That elimination diet is a really hard one to go through, but I persisted. I stuck to it. I felt like I had no other alternative. I started noticing significant changes. By the end of the 8 weeks, I had lost about 18 pounds, transitioned from insulin and oral medications to just oral medications like metformin. Took another 6 months before my doctor would even consider taking me off metformin. She was very, very worried that the changes were not going to stick. And actually, so was I. My A1C quickly came down after 9 weeks. My A1C went down to 5.2 after being in the high eights. And I slowly got off my other medications because I got put back on that medication for blood pressure, medication for cholesterol, and more. I have been in what I consider remission for the past 2 years. My A1Cs have been well controlled, and they've been well below the range acceptable by traditional medicine. So, if I could achieve these results, I believe anyone can as well. It is not just about strategies, but about mindset, about understanding what happens to our bodies when we go through perimenopause and menopause. Now, I knew about menopause, But it did never dawn on me that a lot of the changes my body was going through had to do with perimenopause. And it took me a long time to really believe that I was going into menopause. So, believing in your ability to change and being persistent is key. I took a step-by-step approach, and so can you. Here are some crucial steps that I took. First, understand my body's needs, where I am, how things affect my blood sugar, stress, diet. I then started to make gradual changes, and I even was seeking support from others who were going or had gone through the same thing. So my story is just one example. There are many, many other people who have been benefited from the functional medicine principles. And studies have shown a positive impact of using an anti-inflammatory diet and improving your gut health, in decreasing your toxic load, in managing and improving your diabetes. While my journey is unique to me, the principles that I use to start getting healthy are not. They're widely validated. So here's my call to action for you. Today, I'm excited to introduce to you this Diabetes Type 2 Solution membership. This is more than just a program. It's a supportive community where you will receive the guidance and the tools that you need. I'm also offering my founding members a one-to-one consultation with me to review where they are with their diabetes management. As a founding member, you'll get an exclusive discount and access to additional resources. But this offer is for a limited time. And the most exciting part is, as a founding member, you will help me guide where the membership goes. What is most needed? What has the biggest impact? What education? What coaching? What tools? What resources? What support? We've designed this membership with an affordable price because we believe that everyone should have access to tools and the support to manage their health. Our focus is on practical implementation. There's tons of information out there. You do have to be wary of the quality of the information. But for us, the focus is not on education and information, but rather on implementation, ensuring that you can apply these strategies after you learn about them in your daily life to achieve similar results. Let me paint a vision of what the membership will look like. It will be a place where you'll find not just health information, but holistic support that includes meal planning, regular check-ins, tracking of progress, and community of like-minded individuals sharing their journeys and supporting each other through this health journey. You will have access to workshops, resources, and even challenges that will hopefully keep you motivated. Our success path is straightforward. First, start with understanding of your current status, setting achievable goals that we then break into smaller goals or micro goals and implement smaller steps. Implementing personalized strategies and receiving ongoing support that will ensure that you stay on track. Here's a brief overview of our success path. This is just an early draft. It's not the set in stone path. So we have 5 stages, starting with enlightenment, and that's where you go from confused and overwhelmed to gaining control, clarity, and direction. Stage 2 is Empowerment Awakening, you go from seeking knowledge and exploring treatment options to making small and impactful lifestyle adjustments. Stage 3 is Transformation Initiative. That's where you start adopting healthier eating habits, incorporating regular exercises to actively take charge of your health. Stage 4, Rejuvenating Mastery, from regular monitoring of your blood sugar levels and adjusting lifestyle habits as you need, because we change as we grow older, to celebrating those small victories. And the last stage is Empowerment Peak. This is the summit. From inspiring others by sharing your journey to contributing to a community of empowered individuals managing their health with confidence. I love to share more details with you, and with your permission, I can explain how you can join and start your own journey to better health. Thank you for listening, and I hope to welcome you in our community soon. If you want to check in with me, send me a DM and we'll set up a Zoom meeting. Or you can send me an email to support@rxhealthandwellness.com. I hope to see you in the community, and I love to share more. Please visit us on our Facebook page, where we're going live the whole week, and we're explaining more about the membership. Thank you.